To the Senate Committee on Rules, Government Ethics and Oversight for Monday night, May 10th, 2021. I'd like to welcome everyone to the committee hearing tonight. Tonight we have a couple items on our agenda. First, we will hear an update on the Unified Health Infrastructure Project, UHIP, followed by, we have one bill on our agenda for tonight, which we'll hear subsequent to the presentation, and that will be Bill 7, Senate Bill 141, Resolution 141 by Minority Leader Algiere. So going back to our first item on the agenda, the first item on the agenda for tonight is an update on the Unified Health Infrastructure Project. And I know we're fortunate to have Director Courtney Hawkins. And Director Courtney Hawkins is the Director of the Rhode Island Department of Human Services. I know she has several members of her team with her. And before I turn it over to Director Hawkins, I want to thank Director Hawkins for her. We've got to know each other pretty well over the years. She's been in state government, her exemplary service to state government over the years. We are fortunate to have her. It's unfortunate we'll be losing her, but we're glad she's with us tonight. Director Hawkins, over to you.
Thank you, Chairman, and thank you, members of the committee, for having us here to provide you with this update on the UHIP project. I'm really proud of the work that we're about to take you through, and I'm here with a team of exceptional folks in state service who have been working with me and our departments to ensure that Rhode Islanders who need access through Rhode Island Bridges have access to it. And so that's going to be our focus tonight. I believe you have a presentation for us that can be pulled up on the screen. In the meantime, I'll just introduce the team that's with me. So in addition to myself, Courtney Hawkins, you have Director Ben Shaffer, who's the state's Medicaid Director, Director Lindsay Lang, who runs our health insurance exchange, HSRI. You have the state CIO BJ Kumar, along with Jim Ritter, who is newly Chief of IT for Applications for the state, but has been working alongside us on the UHIP project for a long time. And you have Matt Stark, who's the EOHHS Chief Administrative Officer. So this team is going to attempt to address the questions that you outlined in your letter to us, Senator, but of course, we'll touch on any topics that we miss at the close of the presentation. So do we have that presentation?
We do. Are we presenting it or somebody there presenting it?
I think you're presenting it.
Oh.
My apologies. The custom is for the administration to screen share as I have to monitor the screen of participants.
Okay, let me see if I can get it. I was told the other, so I don't have it.
Not a problem. Or Director, if one of the team members maybe has it and wants to share it?
I'm not sure anybody has it ready, so.
Okay.
I can do it. I have it, Courtney.
Are you sure? Thanks, Ben.
Yep.
Thank you, Director.
So today we're going to take you through some highlights from the past year as it relates to the system development and implementation. We're going to touch on some metrics that we use to monitor the system's progress and stability, including benefit access across a number of our programs. We're going to highlight the impact of COVID on this program. I think what you'll see is that Rhode Island Bridges positioned the state to implement a number of COVID mitigations very quickly, and that we fared well to ensure that Rhode Islanders had access to benefits and new programs during this time. And we're going to touch on, Director Lang and I will touch briefly on what the impact of COVID has been on our operations and how we've managed through that. So our first slide is just a high-level achievement slide, and I'm going to just have each of the directors speak to a few of the achievements that we wanted to highlight. I will start and then turn it over to Director Shaffer. The first thing I wanted to note is that Rhode Island was the first state in the country to implement a new nutrition assistance program called P-EBT, or Pandemic EBT, that provided the value of missed school meals to families who would typically benefit them from them if their kids were in school. This benefit was provided to people who were SNAP eligible and people who were not SNAP eligible, and required us to use information sharing that we had set up with the Rhode Island Department of Education to get EBT cards to people who didn't typically use EBT and to put additional funds on SNAP household EBT cards. Again, we were the first state to get it out. Some states didn't actually provide this benefit until after the school year was over. And we've continued to do that, and we'll actually be launching a similar program for families who have children who are younger than school age that would typically be in childcare in the coming weeks. We've also been focused on timeliness. You'll know that SNAP timeliness has been something that has been a real growth area for the department over the past few years. And despite COVID, we've been able to ensure that we're processing SNAP expedited and non-expedited applications. And most recently are back to being over 90% timely in the process of those applications. So those are just a couple highlights. We're going to hit a few more in the presentation, but Director Shaffer, I'll turn it over to you next.
Well, thank you. I'll touch briefly on the last item in the middle column, enhancements to technology, people and processes to reduce the LTSS or long-term services and support application backlog by 60%. This has really been a joint effort across the project, EOHHS, DHS, DOA, and across, as the slide says, technology, people, and process, which is often a framework we use as we make changes in Rhode Island bridges to recognize all that can go into achieving an outcome like that. So now we'll touch on the specific metrics a little bit later in the presentation, but this has really been an all-hands effort to not just look at the technology and streamline it from the way in which caseworkers and nurses receive tasks to work, but how we make sure that providers are receiving communications on applications all the way to the data that we use to monitor. So we're particularly proud of this work and think it shows dramatic improvement for residents as well as long-term care providers in the state. And I believe I'll pass it to Director Lang for other updates from HSRI.
Thanks, Ben. I want to talk about something in the first column. So these additional federal tax credits, which are contributing to health coverage affordability, and one of the lesser known provisions of the American Rescue Plan Act, which was passed into law just about 2 months ago. We were among the first states in the nation to be able to begin implementing these changes under the ARP, which will bring hundreds of dollars each month to Rhode Island who are enrolled in health coverage through HealthSource RI. There are going to be additional tax credits who are already eligible for them. It will eliminate the cliff, as we often refer to it, providing tax credit eligibility for higher income households who still need that assistance to cover the cost of their premiums each month. And it will also provide enhanced help for any household who have received unemployment insurance for at least a week in 2021. So really significant help that we're really proud we were able to implement through the system and through our customer service channels to get that help immediately as possible into the hands of those who need it. I also want to talk about the middle one in the final column, which is an effort to send customer communications electronically, which allows us to be more responsive to system users' preferences, but will also bring $240,000 in annual savings to the project merely by providing an electronic notice to customers when there's important information for them in their account. We're also going to expand on that this summer by providing invoices for HealthSource RI customers electronically as well. And I believe I will hand it next to my colleague, BJ Kumar.
Thank you, Director Lang. So what I would like to through this presentation is Jim Leiter. Jim Leiter has been with the state doing the RIBridges program, delivering it as the most recently as a project exec, and before that as the project lead. We are fortunate to have him join our team as a state employee and leading up the agencies and enterprise applications. So both of us will be covering the IT side. So in addition to what the directors, Courtney Hawkins, Lindsay Lang, and Ben Shaffer covered, from a technology perspective, with the significant efforts on the program, we're tightening the IT governance, the program governance. Along with that, we have prioritized software and hardware upgrades to strategically reduce technical debt as well as improve the cybersecurity posture. I will talk more about this in subsequent slides, but what we have done, some of the things are listed here: new version of the Oracle database, digitizing email and mail and notices, as well as upgrading the security program, several upgrades. This has really helped us in reducing technical debt and improving the cybersecurity posture. Next slide, please.
Thanks, BJ. This slide, we're going to talk about a few of the functionality improvements that you called out in your letter, Senator, but certainly there has been and will be continued ongoing work that we'll talk about throughout this presentation. The bottom of this slide gives you a sense of what the enhancement and system improvement activity looks like. I would say I'm really proud of the governance model that this joint team has implemented. It is robust and makes sure that we're not making changes in the system that aren't appropriate or that aren't ready to be implemented safely. We continue to do monthly releases. Our minor releases cover small improvements or defect fixes, and then we do quarterly major releases, and we'll talk a little bit about the focus of those major releases. Before I turn it over to Director Shaffer to talk about some of the work that we've been working on to improve Medicaid, I did want to note that one of the big focuses we're looking at from DHS's perspective is on improving and increasing SNAP payment accuracy by making the system smarter and helping workers know how to navigate through the system. And so we have a number of efforts ongoing through this year that will be aimed at improving the system in this way, and really partnering with the DHS workforce to see how we can help improve the system to make it easier for them to use. We've also implemented a number of interfaces over the past year. SSA is one of the ones that we've really been able to leverage to ensure that our processing of the state supplemental payments is done quickly, and that we're able to use SSA information to help qualified people for Medicaid through interfaces. And that's gone extremely well and has been a long effort with the DHS and the Medicaid team that we're particularly proud of.
Thanks, Courtney. And I'll touch a bit on the other two items that are on this slide. So starting with enhancing Medicaid eligibility functions. And this is consistently something that we look at as we implement new policies, new state plan or waiver amendments, new items passed by the General Assembly, or receive new guidance from CMS. So this is an example of new Medicaid and DCYF child welfare policy. Prior to this policy work into these technology changes, individuals and families and kids who needed access to certain services would need to relinquish their child to DCYF in order to access those services. With this change, that's no longer necessary. Rhode Island kids and can receive these Medicaid covered services without relinquishment to DCYF. While it's not a large group of people, to those families who are now able to receive these Medicaid covered services and have those be processed much more seamlessly, I should say, through Rhode Island Bridges, working with DCYF and Medicaid, it makes a very, very big difference. And it's a good example of where Rhode Island Bridges is often the place in which these policy initiatives must be implemented, and where we continue to use roadmaps like these to prioritize and to program and to roll out this new functionality. Similarly, as many folks are aware, we have a goal of increasing rideshare enrollment, and in particular, as part of the governor's recommended budget, have some proposed policy changes to further improve rideshare enrollment. But we wanted to make sure that we started this work, particularly on the operations technology side, prior to any action from the General Assembly, and regardless of any action from the General Assembly. That is, there's been a variety of different pieces that we've done within this rideshare enrollment. So you'll see it in 2 different time periods, in February 2020, as well as our upcoming release in August of 2021. What we did there in February 2020, we really focused on the employer enrollment side. So getting rideshare rates and other information from employers in as seamless a way as possible. Working with employers on the design and making it easier for them to work through. Similarly, when we come to August, we'll be focused on the client side and on the worker side. So how do we most efficiently, with the workforce that we have, enroll individuals who are eligible in rideshare and communicate with potential rideshare members. So we look forward to that going in as well, and we're particularly excited to continue work on that program.
We just wanted to highlight, in addition to the system work that Ben highlighted and that we'll talk a little bit more about, we're incredibly focused on customer service and determining new pathways for customers to be able to engage with our departments, to make it easier for them to access benefits and ensure that the department remains in compliance with federal rules, and that we're providing an efficient work experience for our employees. And so over the past year, we actually piloted a small version of a mobile app that complements our customer portal, and provided our users with an opportunity to look up the value of their EBT benefits on their cards, to look at their Medicaid enrollment or health insurance enrollment, and to also upload documents when they needed to provide documentation to the department. So again, we took it really slow and small, but have been really pleased by the results so far, and we'll be looking to see how we can expand on the use of that app to achieve some of our shared business goals. We also received a grant from the federal government to fund the implementation of some software that will allow us to do texting alerts and reminders to customers. So when they have some kind of reporting requirement or something due to the departments, that we can engage with them through a mobile device. And so we'll be working on that in the coming months also. We believe, again, that these implementations will provide an enhanced experience for the customers and for the staff of our 3 departments. So we're going to move in a little bit to give you a high-level overview of some of the metrics related to the services that we provide. And so we'll start with human service metrics, and then I'll turn it over to Director Shaffer and Lang to talk about some of the health insurance metrics. You all who have followed this know that one of the key metrics we watch is SNAP timeliness, as I said before. As a reminder, the department has 7 days to determine eligibility on an expedited SNAP application and 30 days on a non-expedited SNAP application. And we were subject to a lawsuit when I joined the department, because you'll note in 2017 that we were only achieving those timeliness standards in about half the time. We are now averaging more than 90% consistently in both of those measures. Director Shaffer touched briefly on long-term care. I would say a 92% timeliness standard, and that's the number of applications, complete applications that we determined to be eligible within 90 days. We're doing that 92% of the time, and I'm proud to say that currently the department only has 40 overdue applications pending the department's work. That has been much higher than that during our shared tenure with this project, and I would venture to say that it's probably never been this low in the history of the state's long-term care program. And so incredibly proud of the work that the team did to get us there, and we'll continue to make improvements to ensure that Rhode Islanders who need access to long-term care are able to both get access and find the right level of care for them and their family. We've also seen tremendous reduction in pending applications across all programs. the speed through which workers are able to determine eligibility, and have continued to focus on accuracy and efficiency in our child care payment processing, which I'll touch on a little further into the presentation, has been incredibly important during COVID as we've attempted to support our state's child care infrastructure to ensure that it is healthy and is able to support working families in Rhode Island as part of our recovery.
Thank you, Courtney. I'll touch on the first measure here on this health coverage program metric slide, which we wanted to include in addition to the human services metrics that Courtney just walked through. On the Medicaid side, obviously, we look at application timeliness or new application timeliness that Courtney just went through. But a big part of what Rhode Island Bridges processes for the Medicaid program is not just new applications, but renewals. And in particular, renewals and any other eligibility verifications that happen or need to happen per federal requirements on a quarterly basis. And one of the ways in which we do this, through Rhode Island Bridges, is through auto renewal. So if a Medicaid member has had no changes in his or her case, all of our external data sources that Rhode Island Bridges actually pings up against show no discrepancies against the information we have in the system, that Medicaid member can be renewed without any action on his or her part, which is obviously helpful, not just for the system and for our workforce that would otherwise have to process these applications, but obviously is incredibly important to the continuity of care that a member may be receiving. So this is a number that we look at very, very closely, and we're proud that we've continued to increase that number since the launch of Rhode Island Bridges Phase 2 in late 2016, early 2017. So that additional, 6,000 folks able to be auto-renewed is really a testament to the hard work of the team, both in integrating other data sets and using data to make sure that we're grabbing everybody that we can. And just since there's a big asterisk there, I just want to note that this today number, that 13,000, is provided for February 2020, which is the last month prior to the public health emergency in which we ran renewals. Under the public health emergency and action by Congress, Medicaid renewals and terminations have been suspended since March of 2020, which I will cover on a later slide. Director Lang, I'll turn it over to you to talk a little bit more about benefits to HSRI customers.
Yeah, there are a lot of different ways that we try to assess our customers' experience when they're interacting with HealthSource or I. And of course, the system is a big contributor to their experience and their satisfaction, and frankly, the way that they're able to access coverage and retain that coverage year over year. So these first two metrics are looking at the customer's experience when they're renewing their coverage. We've gone from 75 up to 83% in terms of the customers that we see retain their coverage or decide to remain enrolled at the end of one coverage year heading into the next. The second one is looking at what we call auto renewal, which is the process that we use behind the scenes to streamline the enrollment process and project eligibility for existing customers as they head into the next coverage year. And while we started at a great percentage and started from a strong place at 91%, I think it's worth pointing out here that each percentage point really represents a reduction in customers needing to reach out for assistance. So that may translate to a reduced call volume at the HSRI contact center. It may result in someone who doesn't need to pause their application and enrollment process to reach out to somebody in the community at a navigator agency for help. And it really represents a more efficient enrollment process from one year to the next. So we're really proud of those 5 percentage points and sort of what it represents in the stability of our system and how it's going to work for our customers. The third one is taking a look at the percentage of customers that we survey annually in our customer satisfaction survey who respond that they're able to enroll for the first time or able to complete their renewal without needing additional assistance. So again, without picking up the phone to reach out to the HSRI call center, either with a question about the application or some issue that they've encountered in their account, or perhaps even with respect to picking the right plan for them and their family as they go into a new coverage year. And that really is a pretty steep trend in the right direction, landing us at 65% today. And then I think that's a big contributor into this last metric, which is our net promoter score. So typically something that you hear used in the corporate world, but something that we began to incorporate in our customer satisfaction survey starting in 2017. And it's taking a look at how likely our customers are to view HSRI in a positive light, how likely they are to recommend them to a neighbor or a family member or a coworker because they have had, again, a positive view of HealthSource RI. So we see that we've got 12% more promoters today than we do detractors. And again, a pretty steep trend over just a couple of years that I think indicate some maturity in our system and stability in terms of how our system is serving our customers, which is just a part of the overall customer experience. Next slide.
Excellent. Thanks, Lindsay. I'm going to turn it over to BJ, who's going to take us through a couple of slides about technology and system stability.
Thank you, Courtney. So the committee is very well aware of the history of this program. In March 2017, our IVNV vendor had the project status as red across all health indicators being measured at that time. Since then, the IVNV vendor has continued to raise the evaluation standards across all indicators, including cybersecurity. And I'll cover cybersecurity in further detail. As you're aware, the program and the project governance and reporting have been significantly enhanced. And as a result of these measures, since September 2019, all indicators have been green. So if you look on the right side of the screen here, you can see that business outcomes, system health, scope and schedule management, program management, security, and technical architecture are all green, and they have been green since September 2019. Senator DePalma, you asked us some questions about cybersecurity accommodations in your letter to Director Hawkins. So I'll briefly touch upon that. The state has made significant enhancements in people, process, and technology from a cybersecurity perspective. The ever-changing threat environment requires us to be ever vigilant, very vigilant on cybersecurity, not only on RIBridges, but across the board on all our programs. The state cybersecurity team works very closely with the multi-state ISAC, MS-ISAC, the National Guard, the State Police, Department of Homeland Security, and of course the Fusion Center. The state CISO and the cybersecurity team work very closely with RIBridges state and vendor teams. The state has 2 ISOs, information security officers, and one of them is fully dedicated to RIBridges. All users with access to the state enterprise are required by policy to participate in a yearly cybersecurity assessment program, which includes monthly phishing test campaigns. This is enforced, monitored, and reported to all agencies. The RIBridges program adheres to robust security protocols designed to protect hardware, network, data from unauthorized access, vulnerabilities, and attacks. The system is regulated by mandatory security and privacy compliance requirements, NIST 800-53, MARC-2 for medical systems, and IRS Pub 1075. The security controls in the system are routinely audited by federal as well as state agencies. The system has consistently received an authority to connect, an ATC, which is provided by CMS. Federal partners require quarterly and annual submission of multiple documents. They define and confirm the privacy and security controls that protect the confidentiality, integrity, and availability of the system. In the past few years, we have implemented new products for network monitoring for availability, automated vulnerability scanning, and asset monitoring. We evaluate the network and infrastructure for security risks. As mentioned earlier, we prioritize software and hardware upgrades strategically to improve our cybersecurity posture while reducing technical debt and often saving money by doing that. Next slide, please. Okay, so this is the system stability slide. So you can see that in 2017, the system had over 7,000 reported and unresolved incidents or issues. As a part of the turnaround effort, the state team set an aggressive target of reducing open issues. Since the second half of 2019, ticket issues have remained at very low levels due to the robust maintenance and program governance enhancements. Based on the latest metrics, the system is approximately 134 open incidents. Of these, less than 10% are systems issues. Thank you, Courtney. Back to you.
Thanks, BJ. So on budget, I'm going to ask Matt Stark to take you through the governor's recommended budget for state fiscal year 2022. I just comment that this team continues to focus on federal funding to support not only the system, but all of the work that supports the system, including in some cases eligibility staff and other personnel who are working to provide services directly to Rhode Islanders. And we do that through an APD process, and we had our first annual APD approved this year, which has been a big accomplishment for our team to receive a 12-month approval. And that effort was led by Matt Stark. So I'll turn it over to Matt, who will take you through a little bit more on the budget details.
Thank you very much, Courtney. Could you just advance to the next slide? I just want to echo Courtney's comments, Director Hawkins' comments regarding what's contained in this budget. It includes the operational support in addition to the IT maintenance, operations, and development. As the Director said, we have always emphasized maximizing federal funding for this budget. And expenditure data to date is for the period of federal fiscal 18 through federal fiscal 21. The total expenditures there are around $288 million, and about 76% of that was federal funding. So we've really emphasized that federal funding piece on this project and done everything we can to work with our federal partners for that support. The top lines for the budget that you see summarized here are an $83.1 million total budget. This includes $6.2 million in reductions from the unconstrained request. That's reflective of a sunset of a Deloitte discounts ending state fiscal 21, which increased the budget by $7.3 million. But we were able to net out other reductions, $1.1 million through planned reductions through the RFP process, and a $3.1 million reduction for the testing line based on the volume of development that was revised for the planned year, and a reduction of $200,000 where we were shifting security scope from one vendor into the scope for the M&O RFP. At a high level, the budget reflects $24.1 million in general revenue, $27.8 million in federal, and $5 million in restricted receipts. So the slide here has a breakout by agency and fund source, with $5.4 million coming from Department of Administration and HSRI, with a split general revenue and restricted receipts. For the Department of Human Services, the total is $26.4 million, again with a split between general revenue and federal funds of $12.7 million and $13.8 million respectively. And for UHHS, the total amount is $51.3 million, with a split between general revenue and federal funds at $11.1 and $40.2 million. In terms of the question that we received on the budget and the budget remaining to complete the remaining functionality, we wanted to report that the core functionality for the system has been delivered, and we are experiencing a major shift from development and delivery to maintenance and operations. So the federal fiscal 21 budget includes a 27% share of DDI versus M&O, which is down from 41% the previous year and 52% the year before that. So we are steadily moving towards an M&O state. And ultimately, this budget is intended to support, our ability, the project's ability to respond to federal and state policy requirements like COVID-19 and any critical program needs that emerge based on leadership priorities. So I hope that was responsive to the requests that came in, and we'll just pass on to the.
I'll take it, Matt. Thank you.
Thank you very much.
And I'll just use this moment to comment. Matt mentioned that this budget includes projections for the new M&O contract that is set to start at the end of this year. The joint team, as I think many of you know, have worked on a procurement for that vendor, and that procurement is still underway. So while we can't comment on it, I can address your question, Senator, on the if we have concerns about stability as it relates to that transition. I would say that the team has a very robust plan that we are prepared to implement, or I guess they are prepared to implement in the event that there is a transition of vendors, and would be happy to take a briefing related to that in the future after the procurement conversation is resolved. So the last thing we wanted to touch on is how the departments have responded to COVID-19. As I mentioned at the start, I really think this pandemic has given us the chance to demonstrate why a system like this really is important for a state to have. We've implemented dozens of policy changes very quickly. And each of the three departments are just going to comment on a few of them to give you a flavor for what they are. We are still doing this work, and we'll start to do the work of untangling these policy implementations. But I would say that Rhode Island has really fared well and led the country in our implementation, and all of this to benefit people who have needed access to benefits. So I had commented already on the work we did on P-EBT, but I wanted to talk a little bit about our work on childcare. The team at DHS, which manages both our subsidized childcare program and our childcare licensing function for the state, has just done exceptional work over the past year that has resulted in Rhode Island having a childcare system that has been largely open during the pandemic and open safely. And some of what we've had to do is implement new policies to ensure that that system was strong and had the resources that providers needed to be able to stay open, and that families had access to those benefits safely. And so we did things like change our payment structure to pay based on enrollment instead of eligibility. We waived co-pays for families, and most recently have been paying out a stabilization fund that uses data that we have about our licensed childcare providers, and pays funding out across both our subsidized and unsubsidized system. We also implemented a number of policy changes, including the waiver of interviews, extension of renewals. All of these required changes in the system very quickly, and our joint governance team was able to do that without missing a beat while we all worked remote and had to change our physical operations. As it relates to DHS and how we've operated during COVID, we have had closed lobbies, but have had some staff on site. We've had about 30% of our workforce transition to remote, and have made physical changes to our offices to allow the other staff to be able to work safely in the office. We implemented a number of changes to ensure that customers didn't need to come to our offices anymore, including telephonic signature. I think that's been the largest innovation, and that will be something that we maintain into the future, which will change the way DHS operates forever. So with that, I'll turn it over to Ben to talk a little bit about the Medicaid mitigations.
Thanks, Courtney. If I try and figure out where the mute button is, apologies. I went through on a prior slide, the work that was done to improve our auto renewal functionality and other program integrity functions. And ironically, for the purposes of COVID-19 and this slide in the middle column here, what I'm going to be walking through is how all of that had to pause and pause quickly. So on about mid-March, Congress passed the Families First Coronavirus Relief Act. This is the first coronavirus bill that went through Congress prior to the CARES Act. And as part of the Families First Coronavirus Relief Act, any state would receive an increase in federal funding for Medicaid, provided that they meet certain program requirements. And simply put, those program requirements were that effectively all Medicaid terminations and all renewal activities would cease for the remainder of the public health emergency that obviously that we are still in. A very, very, in my personal opinion, a reasonable and good policy in the middle of a public health emergency and a pandemic in which access to medical care and therefore health insurance is paramount, but a significant operational and technical challenge for the state to implement, and again, implement quickly. Effectively, what we had to do is take the eligibility system that is designed to not just process these things, but process them as automatically as possible, as Director Lang and I just went through, and shut it off. But not just shut it off in a way that we'd be able to turn it back on when the public health emergency ended. So that work occupied a significant amount of our vendors' time and certainly of the state team's side in interpreting guidance and going through individual eligibility categories and individuals to understand how this could be done, how we could do it in a way that was least disruptive to members, least disruptive to the technology, in a way that we can track, because obviously this has fairly significant caseload and therefore budget implications for the state. So we're very, very proud of the way in which we're able to do that, and you can see some of the numbers on the slide. So a little over 22,000 Medicaid recipients have remained eligible that otherwise would have been terminated. These are 22,000 folks who would otherwise have lost coverage, and we are happy to be able to keep on the rolls. Specific to long-term service and support, there were interesting challenges with patient share or beneficiary liability or cost of care, where usually individuals would have to adjust that amount they would pay for their care, but which was suspended. And in doing so, we had to make a number of changes. And then finally, as we proceed to recover out of the public health emergency, CMS issued guidance in November of 2020 that would allow states to begin reprocessing renewals. Not allow for termination still, but allow for reprocessing of renewals, in particular if individuals did not have to do anything to maintain their eligibility, and certainly if the member was not going to be terminated. So we went through a series of data analysis to understand how many members that would apply to, and have been able to, over the course of the last several months, automatically renew Medicaid eligibility for approximately 75,000 Rhode Islanders to date. And that activity, I believe, will wrap up at the end of next month. So we're starting to plan for the future as best we can, and very happy to be able to use the Rhode Island Bridges system to do so in a way that keeps program integrity, even during the public health emergency, while also allowing Medicaid members to maintain coverage and not, quite frankly, have to do anything to maintain it as well. So with that, I'll turn it over to Director Lang for more information on COVID impacts on HealthSource RI.
Sure. So as Director Shaffer mentioned, it's been a year where I think folks have realized that health coverage is more important than ever. And so it's been critical that we have had our teams focused on ways to adapt what we do in normal times to new ways of doing it in COVID times. And we were able to bring our contact center operations fully remote, bringing all of our quality assurance work, our training work, which has been really important in terms of adapting to the changes in policy, particularly around the Medicaid renewal pause and making sure that we were ready to respond to customers' questions about their Medicaid coverage, assure them that they would retain their coverage. And then, as I mentioned earlier, adapting to some of the changes under the American Rescue Plan. We also closed our walk-in center. Like DHS did, we sent our staff to work remote. But that allowed us to open up some new customer service channels and perhaps emphasize some channels that had been lesser known. So namely our web chat function, customers are able to go onto our website and use that tool to connect with our contact center almost immediately and get help with account questions, application assistance, and decision support as they pick a plan. We also offered a number of virtual events through Zoom, which served in place of our typical in-person enrollment events that we hold throughout the year. We've done those virtually. And also, I will just take a minute to recognize our Navigator network, which is has been a huge part of our response and our ability to continue to offer services around the state in various communities to people who need that one-on-one assistance. So following our virtual events, our customers were able to sign up for an appointment with a navigator to get that one-on-one help that so many of them rely on. We also did open on a very limited basis in-person assistance ahead of our annual open enrollment period to ensure that anyone who needed to make an appointment to sit across a table and get that assistance was able to do so at our walk-in center. But I will say that I think a lot of the lessons we've learned in terms of moving remote and operating in a virtual environment, we are now assessing in terms of using them on a go-forward basis. So what elements of remote call center technology and staffing might we incorporate on a long-term basis? How can the new mobile app pilot that Courtney mentioned continue to play a role in our customer service strategy long-term? And I think virtual events will remain a mainstay of our overall customer service approach. So definitely some silver linings in terms of our lessons that we've learned over the last year. Some of the things that we were able to do in the system were equally as critical. As I mentioned, we are in the middle of implementing an historic investment in the ACA infrastructure, so gaining health coverage through the state exchanges, and also unprecedented amounts of affordability assistance that will bring over $30 million in additional financial assistance to Rhode Islanders who enroll in coverage through HealthSource RI. And it's because of that implementation that it's so critical that we've been able to offer this new enrollment opportunity that you see on the slide in front of you. It's open presently. It began in mid-February and it will run through mid-August. It's been really important to just give folks additional time and capacity during an incredibly difficult year to enroll in health coverage. And now all of our existing customers, as well as Rhode Islanders who remain uninsured or who are enrolled directly through a carrier, not through HealthSource RI, will be able to have this additional time to access the additional affordability assistance being provided under the American Rescue Plan. So it's an exciting time. It's been one of the bright spots in terms of our team's ability to focus on ways that we can bring additional help and assistance to Rhode Islanders as they access health coverage.
Thank you, Lindsay. So Senator DePalma, with that, I think that concludes our presentation, and we are here to take your questions.
Director, thank you very much. Job well done. Didn't expect otherwise. And thank you to your team for the excellent work as well. And Lindsay, Ben, BJ, Jim, and Matt, thank you very much. I have several questions, but we'll go around the committee. We'll try and do them round robin. Any questions by committee members for the director or anyone else on her team? So, Director, the first one I have, you mentioned earlier, having to do with the the suit that was filed by the ACLU, is that now closed?
Yes.
Okay, I thought it was. Thank you. Next question with regards to the mobile app, the new customer engagement model. I think Lindsay talked about that, or somebody, I forgot who talked about it, neither. With regards to, as new clients sign up in the future, will they automatically have or encouraged to have the app downloaded for them so that, not that everybody has a cell phone, but their cell phones are certainly ubiquitous these days, that the ability to reach them much easier than via mail or US mail or email or whatever via text might be. Is that something you're looking at for an auto enrollment into the mobile app? Not auto enrollment to the
Yes,
system.
Senator. We've been piloting different kind of small campaigns. As I mentioned, we wanted to keep it small, but we've done some campaigns to engage customers. And part of what the team will do in the future is think about how we engage customers at every point. So you can imagine if you call one of our call centers, that a customer should expect that someone will ask them if they know about the app as part of that experience and encourage them to download it. So we will be offering more functionality that is more helpful to more of our customers and encouraging, lots of people to download the app and implementing a full campaign as it relates to that.
Thank you, Director. Questions from the committee before I ask others? Okay, moving on, Director, to there's a combination of folks who brought this up with regards to the Human Services Program metrics. I think your team needs to be congratulated to what you have achieved, and I think what they'll continue to achieve. So thank you there. The question with regards to the pending applications across all programs that we have, a little over 3,000, just north of 3,000 applications. Whether that number should be zero or not, let's put that aside for a second. What's the main obstacle or hurdle to drive that number, I'll say as close to zero as possible? There's always going to be something missing, so it's never going to be zero, I would suspect. But what's needed to bring that number down more?
Yeah, to clarify, Senator, that number is not overdue applications. That's
Right.
just applications pending the department's work. So that would never be zero. And what is, always expected as every day there are new applications coming in.
Okay, I thought that was the case. Those are ones that were lagging or delayed for a reason. Okay. Questions by the committee? Senator Acosta. Senator Acosta, sorry. Are you on mute? It doesn't look like it. We still can't hear you. No. We can see you. Okay, we'll come back to you in a minute while you're fixing the technical difficulties. Going back to the program metrics, Director Shaffer, you talked about the renewed on a monthly basis, auto-renewed, about 13,000 per month. So I did some quick calculations. That brings us to about 156,000 a year, if it's an average of 13,000 a month. And if we have about 333,000 folks or 300-something thousand folks on Medicaid, there's still a difference of 2,600, just north of 2,600 per month that aren't automatically renewed or whenever they need to be renewed. So how should I be thinking about, I think the 1,300 obviously a good number compared to the 700. How good is it?
Yeah, my mental math isn't as good as yours, so I'll give a slightly more qualitative answer. First, we have to take out from that, let's use 300,000 roughly, the folks who, based on CMS program rules, cannot be auto-renewed. So that's effectively anybody on long-term care that requires a packet to be returned or a renewal packet to be returned. So that's a good, a solid chunk of individuals as well. Similarly, that applies to sort of anybody on long-term services support. So individuals that may be part of the DD population, I believe, don't fall into that bucket. So really when we're talking about auto renewal, we're thinking about the 260,000 some odd folks who are in MAGI, Medicaid expansion, or right care. So that 130,000 starts to look sort of, I think, better compared to that. And then we look at, different ways of I think, basically two things. One, I would say we continually look for ways of improving the eligibility engine and consuming more data from federal partners and external data sources, where we might need some other data point to verify the information according to CMS program regulations. And then the second big piece, which relates to all of the kind of channel strategies that Courtney and Lindsay went through, is we're really trying to do our best to remind individuals that when they have a change in their employment status or their income status or their family status, to report that change. There's always something that external data sources aren't going to be able to flag, or when they flag, that there might be a perfectly reasonable explanation for it. So to the extent that we can encourage members, the Navigator network that Lindsay mentioned, community advocates, to help us ensure that individuals report those changes, the more individuals can be auto-renewed.
Thank you, Director. Senator Acosta, are you back
Can you
with
hear
us?
me now?
Very good. Yes, we can.
Thank you, Mr. Chairman. Sorry about that boomer tech moment. And thank you, directors, for your comprehensive presentation. I have a question regarding right care and potential right care expansion. We have legislation on both sides of the State House seeking to expand right care access to undocumented children and youth who were previously insured by our state about a decade ago. And so my question would be, does your department take any stance on this? And maybe unrelated, or I guess less politically charged, is would the current system that you have for enrolling children in right care be able to process enrollment applications of undocumented youth?
I'm happy to take that. I think to the first part of your question, Senator, certainly looking at ways to expand health insurance access has been one of UHHS's core tenets for the last number of years. Obviously, there's always different considerations there, but broadly speaking, we believe that health insurance access is incredibly important to a healthy population, and we've seen that in the public health emergency, and our very strong health insurance rates in the state put us in a better position to respond to the public health emergency than many other states who do not have the same kind of coverage gains that we had. We also know that anybody who's from the pandemic and anybody who's unable to get care, that affects everybody, particularly as we're looking at those kinds of things. So that's perhaps a broad answer. I think the short answer to the second part of your question is yes. Any kind of eligibility change, and certainly the bill that you mentioned related to using state general revenue to pay for Medicaid coverage for undocumented individuals would probably still go through the eligibility system because that really is our source of record, and it's also what feeds enrollment from a Medicaid perspective. So information from Rhode Island Bridges has to transfer to our Medicaid financial system to make payments and pay providers and the like. So certainly that bill that you mentioned, other efforts to expand access for postpartum women, which is a new potential Medicaid state plan option that passed in the American Rescue Plan, is something that we're also trying to analyze, and I believe there's also bills on. Those are all good examples of where that kind of policy often ultimately needs to be implemented in Rhode Island Bridges.
Sorry. Thank you, Director. Other questions by the committee? Director Kumar. Senator Dela Cruz.
Thank you, Chairman DePalma. I was listening to the explanation by Mr. Shaffer. Thank you very much, Mr. Shaffer. I'm still unclear though. Do we provide health insurance currently to undocumented individuals? Health insurance?
No.
Director Kumar, if we could, you had the stoplight chart, I'll call it, the red, yellow, and green. It's always great to see green, red not so much, yellow not so much, red definitely not. It says on the top of the page that it was independently verified. Who could I consider to be the independents?
Senator, as you know, big programs, state programs are supposed to have an IBM vendor. And in this case, it is CSG. They are the vendor who have been doing the independent validation for the program.
Thank you. Other questions by the committee? I only have a few left. So, Director Hawkins, I know this wasn't your decision back then, but if I look at the system stability, or Director Kumar, not Director Hawkins, Director Kumar, if I look at the system stability chart, one would have surmised that we either went live 6 months too late or 18 months too early, excuse me. Either 6 months too early or 18 months too early, based on the number of tickets that were open. So if we had 7,500 tickets, issues, software issues or system functionality issues in November of 2017, that's a lot. There's no other way to describe other than it's a big number. If we fast forward to May of 18, it came down precipitously, and so just from a slope perspective, many got fixed in that period of time. But we're still at 2,000. It wasn't until we got to almost May of 2019, if my calculations and looking at the curves are correct, that we had just about 1,000, still 1,000 open tickets available at that point in time. Now we're down to 134, and one would say, if you look at, we're clearly in a quiescent state, one would say, because at 130, we're asymptotically approaching zero. We're never going to hit zero with software. We're just not. But if we look at that, that inflection point in the May 4th of 2019, then leading us to November, really November of 2019, was the point that we got to that quiescent state of, on average, roughly a little over 100 and something tickets per month, if I'm looking at this right. It seems that maybe the graph may be off based on the spacing that's there, but what are your thoughts with regards to where we were in 2017 to where we got to in 2019?
Senator, so I joined the state in July 2017, so I cannot talk a lot about before I started or before this team has been on the program. So again, and we all have the lessons learned, and you know it's all public documentation, and we have discussed this at length several times. So going back to where we were, it is the IT governance process, the program governance process, and the leadership of the Syste team who has been responsible in getting us to where we are. Now this system, you know, we had to do a lot of changes, right? So we had to add functionality as well as increase the stability of the system. And Senator, you're well aware of the challenges we have. So we had to serve the people, 300,000 people, we had to serve that on a regular basis as well. So we had a lot of challenges, and yes, it took time. It took time because the program is extremely complex, and it is architected in a certain way. And I think those brutal man-hours were required to fix the solution.
Thank you, Director.
Now where we are right now, we are at a good place. We have been green across all the metrics for close to 2 years, and we will continue that work.
I think under the leadership of Director Hawkins, yourself, and the rest of the team, I would categorically say we are in a very good place right now from a system functionality and development perspective, and really stability perspective, right? At the end of the day, it's the users of the system, both our constituents, the 300-something thousand constituents that might use the system, or the hundreds of workers in the state that are trying to support our constituents using the system. So it's on both sides of those that we needed to take into account. So thank you. Director Hawkins, I'm not going to ask you about, you brought up the thing about the procurement. When could we expect a decision to be announced?
I would say the next 6 weeks.
Okay, thank you. And other questions by the committee, because I think I'm almost down to my last one. So the only other question I have is for, I think it was Lindsay, as it relates to, or Director Shaffer, maybe it was Director Shaffer, sorry, Director Shaffer. On the last slide, Director, where we talk about, and it's something Director Hawkins, you and myself have talked about in the past. I'm not sure if Director Shaffer was there as well, but with regards to the 22,000, just south of 23,000 Medicaid recipients remaining eligible when they would otherwise have been terminated. So we're getting to that point, I'll say sooner than later, as we come out of the pandemic and folks are vaccinated. I don't know how many months they are. I'm not going to guess when that is. Hopefully that's sooner rather than later. And what happens with Medicaid. I suspect we're going to give some of these folks advance notice of what's going to happen, different than the past.
Thank you for the question. So let me start here. So the Biden administration has said that they are going to continue the public health emergency through the end of the calendar year, and that through the remainder of 2021, and that they will give states at least 60 days notice prior to ending the public health emergency. So we are operating, and our Medicaid caseload testimony from last week, or 2 weeks ago, specifies that we do not expect restarting any termination or renewal activity until January of 2022. CMS under the previous administration issued guidance about how states could resume that termination activity and that renewal activity. So that is the guidance that we are currently operating under and moving from. And I believe in our caseload testimony, we anticipated that it would take a full calendar year, so the entirety of 2022, to catch up. It's very possible that the Biden administration will amend or otherwise revise that CMS guidance, and then we'd have to, review that separately. To your question about noticing, there are kind of standard noticing requirements that we certainly will follow, and in particular for renewals, individuals receive a renewal packet, or are sent a renewal packet, I should say, 60 days ahead of eventual termination date, with a reminder or two in between. Certainly, we also think that we'll need to do additional outreach and education, since it will have been a while since individuals will have received notices from the state, asking them to renew or provide information. All of which is being, worked out starting this summer, and hopefully we'll be able to adjust to any additional information from the Biden administration that might come into play. So I would reiterate sort of the call for you all to help us get the word out. If you've had a change in circumstance, change in income, change in job, address, family situation, please report that to us. Call the contact center, go online, and we can do it as easily as possible. And then the last thing I should mention is, we'll need to communicate extensively through all of our partners, community organizations, providers, our managed care organizations, long-term care facilities, who will often assist Medicaid members and their families with these renewal applications. All of those dates will need to be, where they might have been in the past, will need to be reset. So as I've described, this is a not an insignificant amount of work. It's work that that we feel comfortable doing. We feel comfortable with where the data is, but we know that come 2022, this is what the team will be spending a significant amount of time on. And as we get closer to those dates, we welcome suggestions and feedback on how to get the word out to make sure anybody who should maintain their coverage is able to do so.
Director, thank you very much. And whatever help we can provide with regards to helping facilitate that notification, because while you're going to get a lot of calls, I suspect we'll be getting some calls with regards to, this is about to happen, I just got this note, what does this mean? So however we can tell folks once, twice, 3 different times, many different ways, I think it'll be incumbent upon helping us all get through that change that's about to happen. Any other questions by the committee? So, Director, let me finish where we started, since we don't have any public comment, correct, Jimmy? We have no public comment, so we will close this part of the segment shortly here. Director, we're fortunate, Director Hawkins, for you and your team for the work that you've done in really turning the corner with UHIP/Rhode Island Bridges. Having followed this very closely for the last, I think I forgot when we went live, if that was 2016 or 2017. I don't remember the date, I think it was 16, but you've really turned the corner with this, Director. We thank you for that. This was not an easy task. It was not for the faint of heart, and clearly you're not for the faint of heart in doing that. So we thank you for that, and we thank you for your, well, I'm sure we're going to see you, a different committee will see you on Thursday, but from behalf of the committee, I want to thank you for your exemplary service to the state. So, Director, thank you very much, and thank you to your team.
Well, Senator, on behalf of the executive committee, I just want to thank you in particular. You have been in our corner always, and we have felt that and have been grateful to you, and even in the hard times. And I think we would not have made it to where we are without your help and your support over the years. So thank you for that, and I trust you'll continue to provide that support to the team, and we are grateful. So thanks to the committee for having us tonight, and appreciate all your support.
Director, thank you, and have a good night. Thank you.
Bye.
So, committee, that closes the first part of our agenda. The second part of our agenda, we have a Senate resolution by Senator Algiere, a joint resolution to approve its Senate Resolution 141, joint resolution to approve and publish and submit to the electors a proposition of amendment to the Constitution of the state, referendum on line item veto. And this will provide for the publishing and submission to the electors a proposition of amendment to the Constitution of the state of Rhode Island for a line item veto. I don't believe we have Senator Algiere with us, correct? Oh, Senator Dela Cruz.
Thank you, Mr. Chairman. If you would allow, I would like to present the bill to the committee on behalf of Leader Algiere.
Absolutely, Senator, over to you.
Thank you. So I am pleased to support and co-sponsor this with Leader Algiere, S-141. As you said, it is to approve a resolution for the voters to amend the Rhode Island Constitution to allow for a referendum to amend, to add a line item veto as part of Article 9, known as of the executive power. For the benefit of the public, the line item veto is a budgetary check and balance that exists in 44 other states. The veto allows for governor to delete specific spending line from a budget, subject to the legislature's override vote. I understand, every year we've heard stories of some budget excesses, like Dr. Pedro, the chiropractor who was set to receive $1 million, have come to light. Much of the budget sometimes is an opaque process under which our state spends more than $10 billion per year. So we believe it's time to bring more transparency to Rhode Island's budget process. And as I said, this bill is about transparency and good government reform. So I know shortly we will be hearing from Ken Block, who was very passionate about this legislation. And as I said, Senator Algiere has submitted this legislation, but probably now for about 8 years. So I will leave it at that and allow Mr. Block to testify when the time is right.
Senator, thank you very much. Much appreciated. Jamie, we have Ken? Folks, we'll have Ken on the line in a minute. Good evening, Ken. How are you tonight?
Oh, I heard you, and then you cut out. Sorry.
Good evening, Ken. How are you tonight?
I'm fine, Mr. Chairman. How are you?
Very good. Ken, over to you. We know you're very
Great.
passionate on this topic and have been for many years. So go ahead.
Great. Thank you so much for the opportunity. Good evening, members of the committee. I'm here to discuss very briefly the line item veto and what it means for Rhode Island and why this important fiscal reform should be made here in Rhode Island. In a very quick recap, the line item veto is a check and balance in the budget process. And what I mean by that is currently in Rhode Island, we have a fairly non-transparent budget process. The House, the governor submits a budget to House Finance. House Finance receives the budget, holds some hearings, does a lot of things behind the scenes, and then near the end of the legislative session, brings out a budget, and then the legislative process to vet and approve that budget is done in a very, very compressed time frame of just a few weeks. The public doesn't have much access to the budget information except via the hearings. And once the budget comes, it's an all-or-nothing situation. The Senate receives the House-approved budget, and they only have the option to reject the entire budget or accept the entire budget. Once that happens, the budget's transmitted to the governor, who also can only accept or reject the budget in its totality. And the problem with that is that there's a spending line item in there that's objectionable. It's not necessarily good government to blow up an entire budget because there's a problem with one of the spending items inside that budget. 44 other states do it differently. They have what's called the governor's line item veto. And the way the veto works is when the governor receives the legislatively approved budget for signature, 44 other governors in the United States have the ability to reject individual spending lines. But that's not the end of the road. If a governor rejects a spending line, they veto the spending line, but then that veto is resubmitted to the legislature for a potential override vote. So the governor doesn't have the final say in the budgetary process. The governor can present a roadblock to one specific spending item, and that one spending item could be overridden with a legislative override on the governor's veto in the exact same way that a governor's veto of a bill can be overridden by the legislature as well. So it's a transparency mechanism. Budget line items that are good, that are vetoed by a governor, typically are overridden by the legislature. Spending items that are bad oftentimes cannot get the support, legislative support necessary to override the veto. And that's really the way it makes sense, and that's the way it should go. The pushback on the veto really emanates out of the House. And interestingly, the Senate a few years ago, as I'm sure you're probably aware, unanimously sponsored a line item veto bill that was the lead sponsor was Senate President Ruggiero. So I know that the line item veto is a mechanism that the Senate could be very supportive of, and frankly, they should be very supportive of it. because it is the very definition of good government. In fact, the House should be very supportive of it, because the more transparent our government is, the better our government will be. So, it's really basic. We've watched governors from both sides of the aisle use the veto. We've seen Massachusetts governors, both Democrat and Republican, have used the line item veto in Massachusetts for decades. Every year they do it. And their world doesn't stop. And in fact, things seem to go pretty okay up in Massachusetts. So, I look to them as a good beacon for us, for whom to emulate. And speaking of emulating, the bill that you're considering right now should not be the line item veto bill that should be passed. And the reason I say that is because the bill is very nonspecific about what form the veto should look like, how it should work, because all of that should really be part and parcel of the amendment that we're going to ask the voters to pass if the legislature, both chambers, decide to bring the bill to the floor. And what I would suggest for a version of the veto that would be the right one to consider for passage would be the version that the Senate unanimously sponsored a few years ago. Governor Raimondo asked Senate President Algiere and also Speaker of the House Mattiello to sponsor a very specific line item veto bill. I don't have the Senate number in front of me, but I do have Speaker Mattiello's version from the 2017 legislative session. It's H6119. It's specific. It lays out a fair and appropriate mechanism for how the line item veto should work. And that, in all honesty, should be the bill that we consider and that we ultimately pass to ensure that we put in place the right form of the line item veto that will work best for not just the public, but the functioning of government and for a wholly transparent budgetary process. Rhode Island should not look overly differently than the majority of the other states. And when it comes to the line item veto and our budgetary transparency, we don't look particularly good at all. And I'll refer you to it feels like a lifetime ago, but just 2 years ago, we had some scandals in the budget. We had a Dr. Pedro who had $1 million line item for a medical procedure that wasn't approved by the authorities in Washington, D.C. There were some other small things, and, what's $1 million in a $10 billion budget? Well, $1 million here and $1 million there adds up to a lot over time. And, there's no way that once a budget line item makes it into the House form of the budget, that it's home free. And that's really what the budget process looks like right now. It's lacking the check and balance. So I urge you to seriously consider the line item veto. I urge you to consider passing this bill, and let's bring Rhode Island's government up to snuff with how other states do their budgets. Thank you.
Ken, thank you very much. Obviously, very passionate on the topic, as you have been for many years. Questions by the committee for Ken? Ken, thank you very much for your testimony tonight. Much appreciated. Thank you.
Thank you very much.
You're welcome. So just for the committee, as we move forward, or for those who are watching that we will be calling shortly, we have about 75 folks who signed up to testify. So we're going to limit testimony to 2 minutes. If everybody uses their 2 minutes, that will be 2.5 hours. So we're going to be working down the list to see who might be available to speak, not. The majority of folks, for the committee's benefit, I'll try and do it as we go along. Almost everybody's in support, and I believe there are 2 who are opposed. So stand by. So Committee, Richard will be joining us shortly. Dyer. Richard Dyer on the line?
Yes, sir.
Richard, welcome to the Senate Committee. If you could please keep your comments, your testimony till 2 minutes or less, it'd be appreciated. Thank you.
Oh, okay. Yes. Just some thoughts on the line item veto. It's something that, in normal business, you don't just put everything together and go for it. You want to be able to pick and choose what you're going to do and pursue in your business career. And I think that's something that in the Senate and should be done as well.
Thank you, Richard. Any questions for Richard? Richard, thank you for testifying tonight.
You're very welcome. Thank you.
You're welcome. Committee, stand by. Committee, thank you for your patience. We're going down the list. Committee, stand by. So Committee, Charles Collins III will be joining us. Good evening, Charles. Welcome to the Senate Committee. We'd ask that you try and keep your testimony to 2 minutes or less. Over to you, Charles.
I'm good. I understand I don't have, it won't be more than 2 minutes, so can I start speaking now?
Yes, sir. Thank you very much, Charles.
Okay. Basically, yeah, I agree. I do believe we need a line item veto, and I don't see why. Well, I don't see any reason why we shouldn't have it. I think it only helps the people, and I'm all for it, and that's basically all I have to say.
Charles, thank you very much. Any questions from the committee for Charles? Seeing none, Charles, have a good night. Thank you, Charles.
Thank you. 35. Bye.
Committee, stand by. So we just want to let you know, folks, Tassos Barakos is in support, but is unavailable to testify. But he's in support. We're trying to reach Carl Augenstein, also in support. We're going to try and reach Ted Vecchio, also in support. So Ted Vecchio in support will be joining us shortly. Good evening, Ted. Welcome to the Senate Committee. I ask you to try and please keep your testimony to 2 minutes or less. Over to you, Ted.
Hi, thank you for hearing me. I'd just like to testify in support of the line item veto for obvious reasons. We've all watched budget hearings go late into the evening, arguing over specific things that really not much can be done about without the tool of the line item veto. I think it's an important and necessary tool that has to be added in order to properly check and balance the system. So I appreciate you hearing me.
Ted, thank you very much. Any questions from the committee for Ted? Ted, have a good night. Thank you.
Yep.
Robert Carlson had testified in support as well. We're trying to reach Elizabeth Komeyer. Also in support. Unable to reach. We're trying to reach Carlton E. Angel. Unable to reach Carlton Angel. Now to Mark Petchik, also in support. Unable to reach Mark Petchik. Also in support. Trying to reach John M. Causey in support. Trying to reach Laura Murphy, also in support. Roxanne DePippo? Again. Next, reaching Roxanne DePippo, also in support. Okay. We're moving over to Shirley Picard, also in support. Committee, thank you for your indulgence. You might have. Next, we'll be reaching out to Christopher J. Grube, also in support. Committee, stand by. Now on to Pamela Leary, also in support. While we're trying to reach the folks, we received written testimony in support from Jim Kingston, from Jordan Guyette, and Linda Hines. Pamela Leary, we just reached Pamela Leary, indicated she supports the mill legislation. Next up is Paul M. Dumichel. Stand by, committee. Good evening, John. Welcome to the Senate committee. Thank you for being with us tonight. If I can ask to keep your comments to, or testimony to 2 minutes or less, as we have 74 folks we're trying to reach. But over to you, John. Glad you're with us.
Thank you, Mr. Chairman, and you should have received some brief written comments as well. So I'll be brief. I'm just going to reiterate 2 points Ken Block made. One is that we support the line item veto, but we support the version that was introduced several years ago at the request of former Governor Raimondo. That had 2 features that are needed. They're safeguards. One is that it wouldn't allow any vetoes to be overridden in bundles. That would prevent abuse by the legislature, and it would also not allow the governor to veto bills by striking out individual letters or words. They could only strike out whole line items, and that's to prevent abuse by the governor. And so that is something we saw happen with Scott Walker in Wisconsin that was very bad. Our support of this isn't based because we're a fiscal watchdog. You can hear from other groups about that. We care about transparency. You've heard from us several witnesses that we think this will bring greater transparency to the budgeting process because it will shine a light on individual line items that the governor may choose to veto. So that's really the thrust of our testimony. I'm happy to answer questions if you have any.
John, thank you for your testimony. Thank you for your continued support on this bill year after year. Any questions for John Marion from the committee? Seeing none, John, thank you very much for being with us tonight. Much appreciated.
Thank you. Have a good night.
Thank you.
Bye.
Stephen Juknick will be joining us. Good evening, Stephen. Welcome to the Senate Committee. I'd ask if you please keep your testimony to 2 minutes or less. It would be appreciated. Over to you, Stephen.
Sure. Yeah, I just think that it is a good thing to have the single line item veto. I think that too many of the pieces of legislation that get passed, the budget that gets passed, there's a lot of special interests that are included in that, and I just don't think it's right.
Stephen, thank you very much. Any questions from the committee?
Thank you.
For Stephen? Stephen, thank you. Have a good night.
Thank you. You too. Bye-bye.
Thank you. We're trying to reach Janice Peer, also in support. Next, we'll be reaching Carrie Lucier, also in support. Standby committee. We reached Carrie, and she indicated her support for the legislation. Next, we'll be working to reach Peg Bugara. Peg was also in support. Next, we'll be working to reach Joanne Langlois, or Langlis. We're working to reach David Silvestri. We just connected with David. He indicated his support for the legislation. We'll be working to connect with Paul Gallard, also in support. We'll be moving over to, well, Paul Gallard is in support. We'll be moving over to Monette and Stephen Hinger, both in support. Committee, stand by. We're moving over to reach Cynthia Morrison. Committee standby. Committee standby. Committee standby. Committee standby. Good evening, John Vitkovich, also known as John Vitt. Welcome to the Senate Committee. I ask you to please keep your testimony to 2 minutes or less if possible. But John, welcome to the Senate Committee.
Senator Palmer, it's a pleasure to speak to you and your colleagues in this Rhode Island Senate. I'm very proud of what we do in Rhode Island. Belated Happy Independence Day. Senator Palmer, for years we have looked at the line item veto. It is time. 2021 is the year for your colleagues to pass the line item veto. We need to control the state spending in the state of Rhode Island, and we need to have the governor have that opportunity. Senator Palmer, you've heard me say this so many times about what we do in Rhode Island. We got the best. We can have the best state. We operate the state of Rhode Island like the Queen Mary. We got to make a U-turn. It takes us 10 miles. We should operate the state of Rhode Island like my 16-foot checkmate with the 115 on it. We can make a U-turn in 10 feet. So I urge the senators listening to me tonight, I urge them to all consider passing the line item veto this year.
John, any questions from the committee for John? John, thank you very much, and great work on the toll on the bridge, John. Great work.
Senator Palmer, you were an inspiration to me. We did that together, Senator Palmer.
Thank you, John. Thanks for all your help.
Thank you.
Thank you.
Thank you, Senator.
Have a good night.
Bye-bye. Bye-bye.
Just an update, committee. We're just about, I'll say, 55% through the list. So stand by. Stephen? Committee, thank you for standing by. Paul Santoro, welcome to the committee. If I can ask you to please keep your testimony to 2 minutes or less, it would be appreciated. Over to you, Paul.
Thank you very much. Hello, my name is Dr. Paul Santoro, and I'm in favor of the keeping the line item that the physicians have proposed. The mark is difficult to obtain, if impossible, for physicians like myself as we're acting and performing our duties. It's almost impossible to obtain our recertification in these times while providing care to our patients. And I applaud this legislation that will keep us practicing and not let the hospitals or other entities inhibit our ability to practice and continue practicing, or let insurance companies to legislate and to try and inhibit us in any way. So I appreciate you telling me to speak, and I appreciate the time you've allowed me to speak in favor of this.
Dr. Santoro, thank you very much. Have a good night. Thank you.
Thank you, sir. Great. Bye.
Committee, we are just shy of 66% done through the list. Committee, we appreciate your patience while we're trying to reach folks. Committee, we're about 73% through the list. Cheryl Murphy? Committee, we're now through 80% of the list. I've- Committee, stand by. Committee, we're now 90% through the list. Committee, please stand by. We're up to 92%. Yeah.
Someone make their own form that interact with ours. You know what I mean?
Committee, we tried to read a person by the name of Yes on line item veto, but we weren't able to reach them. 95%. Committee standby. Committee, we're up to 98%, the last person, not least. Done? Committee, that concludes tonight's hearing and testimony on Senate Bill, the Senate Resolution 141. I'd like to call on Senator Dela Cruz. Motion to hold, seconded by Senator Acosta. Jamie, can you please call the roll?
Chairman DePalma.
Yes.
Senator Seveny.
Yes.
Senator Acosta.
Yes.
Senator Dela Cruz.
Yes.
Senator Lombardo.
Yes.
Five in favor, 0 opposed.
Jamie, thank you very much. Committee, thank you very much. Thank you for spending the time with us tonight. If I can entertain a motion to adjourn.
So moved.
Motion made by Senator
Second.
Acosta, seconded by Senator Dela Cruz, Senator Lombardo, and the rest of the committee. All in favor?
Aye.
All opposed? Thank you, committee. Have a good night.
Good night.